It's a beautiful day. Lucky that we live Hawaii. 24/7, 365. Swimming in the ocean anytime. Take a leap, health is healthy. We eat well. A, be active. P, live on every day.
Take a little bike ride.
Aloha kako and welcome. I'm Lorilyn Salamanca of the Women, Infants, and Children Program of the Hawaii State Department of Health. I'm your host for this episode of Foundations for Healthy Generations, a program for and about public health in Hawaii. Each month, the Hawaii State Department of Health invites you and your friends, family, and community to join us as we discuss public health programs, initiatives, issues, and public health concerns. In this episode, we will talk about an important component of public health, our Hawaii State Emergency Medical Services Injury Prevention Branch, and more specifically, data and fall prevention. Our special guests for today are Fall Prevention Coordinator Stan Michaels and Injury Epidemiologist Dr. Dan Galanis. Welcome, Stan and Dan, and thank you for your time today.
Oh, thank you. It's a joy to be here. We always relish the opportunity to share a little bit about data and fall prevention, and especially Dr. Dan, he's the man when it comes to all the information we need to make it work.
Yeah, well, I'm always interested when working with public health personnel or staff, how you got started. So, Dan, if you could share a little bit more about how you got started.
Well, geez, at this point, it's been kind of a long road. But you see, I after grad school, I worked in, I would say, sort of more basic research epidemiology around aging and cancer. And this opportunity to come over to the Department of Health, I think in 1997, was a good opportunity for me to take a more applied approach to the field of public health in terms of epidemiology. And I started with what was known as the Injury Prevention and Control Program back then. And I think I've been there since, which is about 15 years now.
That sounds like a busy life that you lead.
Yeah, this field is, as the viewers will see shortly, covers a lot of different aspects, and the content area is far-ranging and takes a lot of attention in a lot of different areas.
Yeah, and I know that you compile a lot of information. So if you could tell us a little bit more about the sources for the information that you compile.
Yeah, my position as epidemiologist or data person for the program is very well supported in that we can do injury surveillance at a number of different levels. The worst, of course, being fatal injuries or deaths that result from trauma. We get that data from Office of Health Status and Monitoring of Department of Health. That's through death certificates. But sometimes we want to get a little more information than death certificates provide, so we'll liaise with the medical examiner's office in Honolulu County and the coroner's offices from the police departments in neighbor islands, because they do much more extensive investigations around, say, drownings or suicides. And then we'll also pull in sort of national databases, most specifically the level of detail that's collected around fatal motor vehicle crashes in the state. That's been a big help to our program for getting a better description of the causes of some of these fatal crashes. So that's kind of how we approach, again, the most serious outcomes, those being fatal injuries. But for non-fatal, we're fortunate that there's the Hawaii Health Information Corporation, which is a nonprofit, which serves as a repository for billing data for basically all medical records in the state, both at the emergency department level and for inpatient or the hospitalizations. So we subscribe to that service, and with that source we can really kind of describe the bulk of the non-fatal injuries or injury morbidity in the state, both at the inpatient level and at the emergency department level. And then finally, even sort of backing up further from that, we're under the State Emergency Medical Services Office, so we have direct access to the basically ambulance paramedic reports for EMS responses around the state, and that's a pretty sophisticated data collection system the paramedics are out in the field with pen-based laptops, entering the data they collect from patients on basically a real-time basis. So that's a very useful resource as well.
That's great. Now, if I understand correctly, this information is compiled in this book.
Yes,
Yeah.
it's that's available on the Department of Health's website. That's sort of a compendium of many of those data sources I just listed for that 5-year period. Useful resource, gives kind of a big overview and a little more detail into a lot of these different mechanisms. That's through 2011, and since then we've acquired 2012 data, so that's also available.
Great, yeah. Well, with injuries, I know that there are, intended, unintended. Does the book go in more in depth about the differences and the numbers for those two different types?
Yes, we, when you try to organize all this data, one of the first sort of divisions that is made, the standard is unintentional injuries, or less favorable word, accidental injuries, versus intentional injuries. And among intentional, that can include self-harm or suicide and suicide attempts, as well as assaults and homicides. So we basically, in general, kind of look at intent for those particular outcomes, and whereas we look at mechanism, so that is a fall, a motor vehicle crash, a drowning, for the unintentional, because those are the points where we best sort of design interventions and approach prevention.
All right. I'd like to hear a little bit more about if there's any, information about severity of falls for seniors or elderly.
Yes, it's a huge problem for even among all the various things that we look at in our office, and in some respects, particularly in the morbidity, really kind of dwarfs a lot of the other things that we work on. Not that they're less important, but it's just it's a function of both the demography, the aging population in the state, as well as the sort of accelerated risk for falls as people age.
Yeah.
So I mean, in terms of scale, we're seeing increasing trends both for fatal falls among seniors, falls that require hospitalizations, and falls that are treated and discharged at the emergency department level. At this point, we have nearly 100 fatal falls a year among senior residents in Hawaii. I believe close to 2,000 hospitalizations each year, and triple that for emergency department visits, so about 6,000 a year. That you add all those together, it's basically every hour in the state a senior is treated for an injury from a fall in Hawaii.
Yeah. Now, Stan, I'm just curious what your thoughts are as well about seniors and falls.
Well, that's the real key. Dan's data is literally the driving force for everything we do in the office. It's the collection point. It gives us direction and details and, as he said, mechanisms. Without it, we couldn't tell the who, the what, the where, the why, the when. All of it has a direct impact on how we try to plan an intervention or a program that might, remove that risk, whatever the case may be. It's really key to everything we do. And like Dan had said, that pyramid that he described, the injury pyramid, it's a very striking piece when you make presentations to indicate that that's the way it is and how severe it is. To have that many people just with seniors and just with falls in our small state, it's an astronomical problem.
It is. And I know there's this term called the silver tsunami.
That's a key. What's amazing about that is that we've been listening about baby boomers our entire life. We've heard about their impact as the swell moved through society when they first went into school, when they got out of school, when they started their families, when they impacted travel and as they grew up in their careers. Well, now, effective December of 2011, the boomers have arrived at 65. So to translate that, every single hour, every day, 10,000 Americans turn 65.
Wow.
Every day, 24 hours a day, 7 days a week, 365 days a year, our American population grows. 10,000
a day, 70,000 a week, 300,000 a month, 3.6 million per year. Now, just because you turn 65 doesn't mean that you have an instant impact, but because the numbers are so huge, there is an impact. Maybe a majority might stay healthy, but those at that age that are not staying healthy, that have reached their retirement age, maybe not in the best of health, then that's where the impact comes, that those numbers then begin to really bump up with not only accidental situations. Well, I hate to use the word accident. Dan has taught me that word doesn't work. There's always a reason. The impact just grows, and it has had an amazing impact on all of our facilities, the medical profession. It's just huge.
I mean, those numbers just sound astounding. The way that it builds up. It's one case, and then it's maybe two cases, and then it's just more and more. And I know, I guess it's dear to my heart because my father is a baby boomer. I mean, both my parents are, and we all care for our loved ones. So I'm curious what the department might have in action to help the silver tsunami or the baby boomers.
Well, we're really blessed. The department works very, very closely with an ad hoc committee. It's called the Injury Prevention Advisory Committee. That group of concerned citizens, the organization was started many years ago by our prior director in our department, Eric Tash, and with his guidance and with the amazing dedication by people of every level, from hospitals, from facilities, from care groups, their impact on that committee. Eric's just said that we have problems that we have to solve. They have met, they get together, and they produce a book each year, every 5 years. And it's an injury prevention plan, the Hawaii Injury Prevention Plan.
I have a copy here.
Yeah, it's nicknamed the HIP, HIPP. And within that book, they really zero in on particular areas. They're intense enough, dedicated enough, and they spend enough time that they not only see the data that Dan has collected, but they then try to come up with interventions, recommendations, what process would make a dent, would make a reasonable attempt to resolve some of the issues, or at least remove some of the risk factors from the entire variety in that book. And of course, there's a lot of product in there, as Dan had mentioned. There's suicide, and there's drowning, and there's motor vehicle crashes, and there's falls. And within that, then we try to take from that book and its recommendations, we try to build on that.
Right, and I think it's very important that recommendations are not just, they look good on paper, they have to be viable and realistic. So that's what it sounds like. They really work together and work hard to get to that point.
Yeah.
I think what probably sets us apart too from national data, well, obviously, is that it's very specific to Hawaii. And then sometimes we don't have mechanisms to collect information to have state-specific, locally specific information. So if you could share a little bit more about how that's come about,
Oh, Dan, you got,
Yeah, it's one of what we view as a core function of our office is to serve as a clearinghouse of injury-related data for people to use at the community level, at the organizational level, what have you. And like you said, I mean, first of all, we want it to be Hawaii-specific because we think we're different in Hawaii, and we probably are, but certainly even within the state, oftentimes what's going on in Oahu is not of great concern when you're trying to address the problem over in, say, Hawaii County. So that's one of the strengths of our resources, that we can sort of localize the data, and through that HHIC data we can look at down to the zip code level, for example, for some of these injury outcomes.
right.
Yeah, and we try not to work in a vacuum.
Yeah.
No matter how much we create locally, you got to realize that around the nation and internationally there are people also trying to solve the problems. So we tried to, in terms of creating our research, take a look at what everybody has been working on nationally, internationally. So many dedicated people on a national level, they become our colleagues of sort. And so we network back and forth and try to gather the data that's going to have some impact. On many occasions, some of that data won't work in Hawaii. We're a very unique culture, very unique place, and those recommendations just don't fly here. We have to clarify.
Right, and I'd like to hear what some of those recommendations are that may not work.
Well, one of the cutest, I think, was in doing falls research. One of the mainland recommendations, it's sort of light, but it was that if a senior was frail, had balance issues, that it was recommended that they wear sturdy shoes that were comfortable both inside and outside their house all the time, 24/7, to improve on their balance. And you can see how well that will go in our state, no matter how. I realize that it's going to be a great benefit to people who don't have maybe a good structure in their feet and they need shoes, and maybe the floors are really cold in New York, but it's not going to fly here. So we have to adapt them, and we do have a warning in one of our things about slippers. The very name of slippers gives its title as to what it's capable of, which is slippage. So we try to recommend against slippers, but just nice shoes when they're outside.
Yeah, it's a straightforward recommendation. It's simple and it's logical, yet culturally it doesn't quite make sense. Yeah,
it doesn't fly.
So there's a good mix of kind of finding common themes nationally and seeing what can work here, and then also isolating the things that culturally would not. So that sounds really good. I guess in the HIP, the Hawaii Injury Prevention Plan, what are specific recommendations for falls?
Well, I think the HIP was an amazing book. It not only looked at all of the mechanisms and all the resources to find out the causes, it took the next step and went for recommendations. They're very, very complex because falls are multifactorial. They're caused by a lot of things in combination necessarily. It could be a combination of balance and maybe medication that had made you a little bit dizzy, coupled together with you hadn't had your glasses changed for a long time, and bingo, you got somebody at risk. So the HIP was very, very good in that it produced a series of recommendations that we're now trying to will out to implement, to work with at greater depth to try to plan something really specific for the state. So we're in that process now.
That is a lot. That is a lot of information, and I can only imagine how much effort, in putting something together that's so comprehensive. How much work that takes.
Well, what's nice about it is that the HIP turned out to be a guiding force for another aspect. We have a wonderful new director at the Executive Office on Aging, Mr. Wes Lum, Dr. Wes Lum. And Wes, in looking at that and in discussions we've had for many years on the issue of falls, decided to convene a task force. And it was an amazing process because he gathered together over 20 professionals from many areas, medical, physiotherapists, occupational therapists, clinicians, physicians, UH researchers, care home facilities, caregivers. They all got together in sort of a gold medal task force and began to gather, not having to reinvent the wheel, using not only the data that Dan had gathered in the injury book, but the recommendation of the HIP. And then they worked very, very over a year to create a new plan. And that's what we're working on right now, is the first ever Hawaii State Fall Prevention Plan. We're going to have a chance to talk about that a little bit later, but it's a great result.
Well, I am impressed at how much networking, all your programs are doing to really create something that is, again, viable, realistic, and something that will work for the community and for our kupuna.
Yeah.
Well, I think we're just going to wrap up this segment and then just find out what your recommendations to the public might be in relation to falls or fall prevention.
Well, I think it would be sort of simplify and take the basics. There's really 3 basic recommendations that came out of the HIP, and we can start with it. Number 1 is to remember that falls are preventable. One of the pieces of social math that's created, and I'll quote it, every 5 hours in Hawaii, a senior suffers a fall injury so severe they must be hospitalized. Not all of them get to go home or regain their full independence. That's a scary fact. So our initial recommendation then, in addition to making the entire public aware, because that's again one of the things that we face. Many people of generation, the boomers, their caregivers, the parents above them, do not believe they're at risk. They realize maybe they're changed a little bit physically and mentally, but they don't feel they're at risk. So try to make them aware is number one. And number one, to try to do something about that is to stay active. We don't need to use the word exercise, but to stay active. Garden, swim, dance, take a Tai Chi class, whatever it takes to keep yourself active, because frankly, if you don't use it, you'll lose it. You just need to keep the entire physical stature aware and sharp, and you can't emphasize that enough. Secondly, some medications can cause dizziness. As you mature, your medications might begin to build up, that you have a lot of them. In concert with one another, sometimes they can cause dizziness. By themselves, they can. In mix with others, especially over-the-counters and supplements, such as an antihistamine with some ginseng and your heart medicine, maybe not be a good idea. So our recommendation is have your medications reviewed by your physician or your pharmacist. Absolutely vital, especially if you have more than 5. If you have 5 prescription meds and a few other things in your closet, take them all in a bag, just make an appointment. There are so many people that will do it for free, and just have them reviewed to make sure that they're not in conflict. In the future, electronic medical records might make that a little bit easier, but not everybody has access to that, so have them reviewed. Third, vision. Have your eyes checked at least once a year once you begin to mature. So many things can sneak up. They're slow growing, you don't begin to notice it, but you might come up with tunnel vision, so many other things, cataracts, that you just don't realize that they're impacting you. And if you can't see it, you can trip on it. It becomes another fall risk. And last but not least, make your home safer. It's one thing to talk about clutter, and that is, in my case, clutter. I keep a lot of newspapers, and if they slide down, it's a fall risk. But there's other things in your home you can do to make it safer. Make sure that all your pathways are always safe. If you do not have a grab bar and you have a balance issue, I would recommend a grab bar in your bathroom, either in the tub or beside the toilet, because having that security is a tremendous importance. If your lighting isn't very good, increase it. The small amount of electrical boost from having a little bit more light in your home. As we mature, again, you lose the ability to gather light, so therefore light is important. The simplicity of a nightlight, the kind that goes on electronically, on at dusk and off at dawn. Tremendous asset, because getting up at night, as Dan's data shows, an awful lot of falls occur right in the home. So to be able to make that a safer place, it's really, really vital. So those are the big 4.
Wow. Well, I've learned a lot in this segment about fall injuries, fall prevention, and how we can take better care of not only our kapuna but also ourselves. Yeah. I hope you can come back again and talk more about falls in the future.
I hope so. Very soon. I think we're on schedule to do something like that.
It feels like we're at the tip of the iceberg.
And we always will key on Dan's data.
Yeah. Well, thank you again for your time. I know taking out time to do this out of your busy schedules can be hard. So again, thank you.
Well, we appreciate the opportunity.
Yeah, and to our audience out there, thank you for joining us today. We hope that you stay well, and we will see you again next time. Ahui ho.
It's a beautiful day. Lucky that we live Hawaii.
24/7, 365.
Swimming in the ocean anytime.